Hey everyone! Today let's dive into an important topic for medical students and professionals alike. The bladder tumor antigen, or BTA for short. Ever heard of it? Well, if you haven't, you're in the right place. BTA is a tumor marker primarily used in diagnosing and monitoring bladder cancer. It's a protein found in the urine of individuals with bladder cancer. Sounds simple, right? But there's so much more to it. When cells in the bladder start growing uncontrollably, they often release proteins and other substances into the urine. BTA is one of these substances. Doctors can detect it using specialized tests, helping them to identify the presence of bladder cancer. Now you might be wondering, why is BTA important? Well, bladder cancer is the fourth most common cancer in men and the ninth in women. Early detection can significantly improve the prognosis. BTA tests can be a useful non-invasive tool for early diagnosis and ongoing monitoring. Here's how it works. A patient provides a urine sample, which is then analyzed in the lab for BTA levels. If the BTA levels are high, it could indicate the presence of bladder cancer. However, it's not a standalone diagnostic tool. Doctors often use it in conjunction with other methods like cystoscopy and imaging studies to confirm a diagnosis. One thing to keep in mind is that BTA tests can sometimes produce false positives. Conditions like urinary tract infections, kidney stones, or even recent bladder surgeries can elevate BTA levels. So it's crucial to interpret the results in the context of the patient's overall clinical picture. Now let's talk about the advantages and limitations of BTA tests. The major advantage is its non-invasive nature. Unlike cystoscopy, which can be uncomfortable and invasive, a simple urine test is much easier on the patient. It's also relatively quick and cost-effective. However, the limitations can't be ignored. The sensitivity and specificity of BTA tests aren't perfect. False positives and negatives can occur, and it's not a substitute for more definitive diagnostic procedures. That's why BTA tests are often part of a broader diagnostic strategy. So in summary, BTA is a valuable tool in the detection and monitoring of bladder cancer. It's not perfect, but when used correctly, it can provide crucial information that aids in early diagnosis and ongoing management. As future medical professionals, understanding these tools and their proper application is essential. Thanks for tuning in. If you found this video helpful, make sure to like, subscribe, and hit the bell icon for more medical insights. Until next time, keep learning and stay curious.